The National Kidney Foundation is fortunate to partner with countless strong and compassionate medical professionals and caregivers who work tirelessly to improve the lives of the 37 million Americans impacted by kidney disease. This year, we're honoring two members of the medical community who truly embody this mission with our Excellence in Care Award. I'm proud to announce our first honoree is Dr. Ellie Kelepouris. Dr. Kelepouris is a professor of medicine at the University of Pennsylvania's Perelman School of Medicine in Philadelphia. She has over 45 years of experience and has served on our local board in some capacity for over 30 years. Dr. Kelepouris has touched the lives of so many kidney patients and has done so with an unwavering kindness and commitment. It is truly my honor to present the Excellence in Care Award to Dr. Ellie Kelepouris.
I've been involved with the National Kidney Foundation for over 30 years. It's been one of the highlights of my career as a nephrologist and as a care provider. I was first introduced to the National Kidney Foundation when I was a fellow learning my craft at the University of Pennsylvania in Philadelphia. I applied for a grant from the National Kidney Foundation, and I realized how lucky I was and how grateful I am to this organization. Not because they set me on my path to my career as a nephrologist, but because they created a community for me within the National Kidney Foundation where I could be a volunteer, I could be a physician, and I could really connect with patients and connect with the society which they created. Fellowship training is really critically important to the development of our future colleagues. And one of the basic tenets of becoming a nephrologist is a good foundation in education and networking. With colleagues, we created the Mid-Atlantic Fellows Forum, and this was sponsored by the National Kidney Foundation shortly after its inception. And it's more than education, though. It really represents creating a community around the National Kidney Foundation, a networking community, so that our young colleagues understand that being a nephrologist, being a physician, is not just taking care of the patients you see, but taking care of the community at large. The NKF has spearheaded many programs, not only in the city of Philadelphia, the Mid-Atlantic area, but really around the country, and international programs as well. We were the first NKF hub that piloted the Keep Screening program. That revolutionized really the outreach to the community. The community which we serve, particularly in the Philadelphia area, is inopportune because they really have some areas very poor access to care. So the Keep Screening is something that I'm very proud of being a part of. And our first screening in Philadelphia, which was I think almost 20 years ago, we screened 600 patients, and it was wonderful. It was a wonderful experience. I was a fellow when I joined the board of the National Kidney Foundation. And so I joined a board where really I was not only the youngest member of the board, but the least experienced in terms of fundraising and leadership. And actually, I've served on the National Kidney Foundation board for the last, I'd say, 25, 30 years. And what I learned from this relationship was really how to sit at the table and have your voice heard on behalf of patients. It has been a long experience. It has been really a very exciting time as we evolved. Kidney disease is a universal disease, and it affects many patients from many walks of life. It's not a very forgiving disease. It really devastates families. And there are millions of patients with chronic kidney disease in the United States and the world, which really need our help. We are really working very hard to expand the treatment modalities that we have for kidney patients afflicted with kidney disease. So we have to be mindful of how we care for patients at every stage of their disease. This pandemic has particularly affected patients with predisposition for kidney disease. It has really revolutionized and galvanized the physicians to move swiftly to care for patients with COVID. The virus is a very unforgiving virus, and we've seen that patients develop devastating illnesses, not only in their lungs but in their kidneys. We were unable to keep up with the dialysis requirements in the acute setting. We moved together as a society and an organization in order to supply the equipment necessary to keep those patients alive. We were not always successful, and we witnessed patients dying without their families, patients saying goodbye to their family members on my cell phone, literally. And the consequences of this disease are really long-lasting. Patients who do have kidney damage, most of them, not all of them, most of them go on to chronic kidney disease and require ultimately either intervention with dialysis or hopefully with transplantation. So we still have very sick patients being admitted to the hospital with really devastating illnesses. It reminded me of the HIV epidemic, where patients came in the morning and they died the next day. It was a very similar trajectory, and it really, as a physician, it kind of centers you. And it tests your resilience, and it really tests your ability to just move ahead regardless of any dangers to your own personal life as a frontline worker. And I think we are a stronger medical community because of that. The part of being a nephrologist, which has been the most rewarding to me, is my connection with my patients. I mean that sincerely. I love seeing my patients. I love taking care of them. And one of the things that really makes nephrology, I think, the best specialty in the world is the fact that you can take care of patients for decades of their lives, and you get to know their families, you get to know their children, you get to know when their children get married. And really, it's just a complete specialty. And that's one of the reasons I chose nephrology, if not the reason. So the patients really are at the center of my mind when I'm in the hospital, when I'm in the clinic. And so in addition to just being their healthcare provider, I've become their friend. They've become my friends.
I ask you all, please welcome Dr. Kelepouris.
I would like to thank the National Kidney Foundation for honoring me with the Excellence in Care Award. I'm deeply moved. I'm grateful. I'm also very humbled by this award. I've been a volunteer for this organization for over 30 years, since I was a fellow in training. I was given the opportunity to continue my career as a nephrologist and as a clinical scientist. Because of seed funding from the National Kidney Foundation, I will be forever grateful for this opportunity. And although tonight's giving and honor night is to celebrate our heroes, I really believe that the true heroes in my journey as a nephrologist have been the patients. I have watched, I am in awe really of their grace, their dignity, their resilience, how they bounce back from disease. And I'm so honored to represent them tonight, and I accept this award on their behalf. I would like to thank my family for their support. I missed events from my children. I was always, I worked when I had to. I took care of patients because I wanted to. And I'm really grateful for their love and support over the last 20 or 30 years. I also want to end by thanking the National Kidney Foundation for making this event possible, and for all of you who are attending. and who are making donations both of your time and of your money in order for us to move all these initiatives from aspirational to fundamental. So thank you very much and have a great night.
Thank you so much, Dr. Kelepouris. Your dedication and compassion to your patients and their families, it truly is inspiring. I know I speak for so many when I say, thank you. Thank you for all that you do for the kidney community.